Claire, nice meeting you. Yep, one of each. Set this right over here.
Okay, once we said, but I kept thinking. They don't. There's a number one cause of healthcare debt. Well, my husband sprained his ankle, I don't know, a month ago. But I'm nothing. Most of the time, I'm just sitting there waiting for me to know. So $1,500 for like that long with it, you know. I like this cloth. It's very pretty. Is that yours or is that
This is an MVP.
Is that part of the swag that stays here?
I
got time blocked out till 3 o'clock today.
All right, good.
Yeah. And then
Yeah.
I will be heading down to Dansville from here.
Oh,
As normally I'm in Livingston County on Mondays, so so that would have been like to go from Mount Morris to Dansville, just imagine. It's actually a food distribution that they do across from Dansville High School.
and then you just go.
I just go and I just provide information. But so today
I
I'll.
mean, it's so complicated for people. That somebody like you would come and say, okay, here's what it is, here's what we do.
Exactly.
Yeah.
And that's part of like with the marketplace. It does become they may select something that will put them into a bucket where they don't qualify for assistance. And it's amazing how many times I'll go through, okay, you selected this as your answer and you should have selected that. Because this is going to basically let the state know that you don't need assistance or you have other insurance. So,
And it's easy to do if you don't know what you're doing.
right.
I had a thing, I've won at
Yeah.
what would have been, it's just one of those regular preventative care things that I had. They didn't deny it, they just didn't pay it, and then I got a bill, and it turned out that they had just assumed I was on Medicare, because I turned 65 this year, and I'm not.
Yeah.
And so I had to go for just, they were pretty reasonable. We got it. Be sure to pick up,
Make sure everyone grabs a folder and there's a journal that you guys can. Yeah, stuff.
You brought presents.
I did. Presents for my presents. No problem at all. Hey, there he is. How you doing, brother? Good to see you. Get together some information. Contact information.
We're not going to be in a sunbeam.
you don't want to mask?
Right.
All right, hello everybody. Thank you for coming to the Justice Hour. Today we have Matt Robinson from MVP, which you can see. And he is going to tell us about Medicaid and Medicare and the people he sees and counsels through helping people stay on their insurance and get the right thing. Matt volunteers at St. Joseph's Northside on Fridays. Not volunteers, but goes there and to help the people there as well. So we'll hear. And then I just want to mention next week we have Lynn Maluli, who is the ex-executive director of Water for South Sudan, and she's going to tell us about that work and what's been going on. I believe that the sisters, quite a few years ago, funded a well, and so what's the ongoing work there and what it looks like now. So, welcome, Matt. Thank you so much.
Good afternoon, everyone. How's everyone doing today? Thank you very much for having me, and want to welcome those of you who are joining online and may be watching this at a later date and time on your YouTube channel. So again, my name is Matt Robinson, and I am my title is Individual Product Advisor. That's with MVP Healthcare. So what we do is we are out in the community. We basically meet with people who need assistance with health coverage, whether they need to renew their coverage or they need to enroll into a health plan. So I have two certifications. I am certified through New York State of Health for state programs, so that includes Medicaid, Child Health Plus, Essential Plan, and Qualified Health Plans. And I'll dive a little bit into what all of those are and what the qualifications are as well. I am also licensed for Medicare products, and I'm not going to go too deep into Medicare, but there is a plan that I would like to bring to your attention for people that qualify for both Medicare and Medicaid. So I'll jump right in. So just before we go on, I'm just going to tell you a little bit about MVP. We're a local not-for-profit health plan. We focus on helping members get their health care, understand their benefits, and stay covered. So what this means, we support enrollment and renewals. We have access to providers across New York State and the state of Vermont. We have helpful online tools and 24/7 virtual care options through our GIA app. So why choose MVP? There's a number of different carriers out there. What makes us stand out above others is we make it easier to get covered, get access to care, and feel supported. Myself and a team of my coworkers, some of us are IPAs. Actually, we're all transitioning to IPAs, but some are licensed and some are just certified for state programs. But you meet with any one of us. We're out at various community sites. As Holly's just mentioned, I am at the North Side location on Lyle Avenue Friday mornings. I'm also at the Asbury Community Center Thursday and Friday mornings. We do food pantries, faith-based organizations. So I'm at the People's Pantry on Wednesdays as well. I branch out into Livingston County and help out with their Department of Social Services. So we have a number of different locations throughout the community. We work with Ibero. We sometimes set up at various apartment subsidized housing facilities as well. So you can find us pretty much out in the community. We have an access to a large network of doctors, specialists, and hospitals. We help manage your health with easy-to-use online tools and resources. Help you get care anytime through our GIA app, which is our 24/7 virtual care. And the main thing is to get local support through a regional not-for-profit plan. So navigating health coverage changes as they come about. We are going to be experiencing a number of different changes over the next few months. And I'm gonna get a little bit into one of those changes that's gonna be coming up very quickly. The coverages can be confusing and stressful. One thing stays the same. We're going to give you clear guidance and ongoing support throughout the whole process. Help to explain the coverage changes in simple terms, support you through your plan or eligibility changes, help you stay connected to care, and provide trusted support all year long. So we service different areas in New York State for our state programs, and this is our coverage map. These areas that are in the dark shaded areas are areas where our state programs are available for people that reside in those counties. So in the Rochester area, our plan is offered in Monroe, Genesee, Livingston, and Ontario counties. And then you can see on the eastern part of the state, it's basically from the North Country downstate into Hudson Valley area. And again, licensed by counties. You can see the number of counties listed here, including Livingston, Monroe, Genesee, and Ontario counties. So, helping you understand the affordable healthcare plans from MVP, there's different lines of business, we call them, and the key differences of each plan, I'll break them down for you. So Medicaid is a plan that's available for people that are on the lower income side of the income thresholds. It serves eligible adults and children. It provides medical, behavioral health, dental, vision, and virtual care coverage, and it's year-round. And it also provides enhanced mental health support for eligible members. Now, an additional support service for people that are Medicaid eligible is a plan called HARP, or the Harmonious Healthcare Plan. And this is for Medicaid members with significant behavioral health needs. We provide enhanced mental health support, substance use support, care coordination, and utilizing some of our specialized providers that provide the treatment for that care. Child Health Plus is for children that are age 19 and under. Any child can qualify for Child Health Plus. So for families that may receive their health coverage through their employer, a great way to kind of cut down those costs is to enroll into a Child Health Plus plan, because it's all inclusive. You pay a monthly premium ranging from $0 all the way up to full premium payment, which I believe is somewhere in the like $230 range. But for the most part, people that qualify for subsidized plans, the most they'll pay is $60 a month. It is all inclusive. It includes dental and vision coverage. There are no co-payments at the doctor. So unlike an employer-based plan where you take your kid to the doctor, if it's like for like an emergency situation, you're gonna have a co-payment. With Child Health Plus, there are no co-payments. So it's a very smart way to have coverage for your children and limit your out-of-pocket expenses. The Essential Plan is a plan that's available for adults ages 19 through 64. And to go back to Child Health Plus, your eligibility for Child Health Plus ends the month that you turn 19. So once someone turns 19, let's say someone's turning 19 this month in May, their eligibility for Child Health Plus will end at the end of this month, and they'll transition to one of our other plans based on what they qualify for financially. So the Essential Plan, again, is for ages 19 to 64. Again, it provides medical, behavioral health, maternity care, dental, and vision coverage, and it's year-round enrollment. So you don't have to hear all about annual enrollment and it's time for you to enroll into a health plan. Essential Plan coverage, Medicaid, these are year-round coverages that you can enroll into as long as you qualify. You can enroll anytime, at any time throughout the year. So MVP has a Medicaid managed care plan. So you'll hear people that have Medicaid, okay. So there's different types of Medicaid. There is regular Medicaid where you have Medicaid coverage, and then managed care coverage through MVP, where you're able to see providers through the MVP network. So sometimes when you have regular Medicaid, certain providers will not accept regular Medicaid coverage. So that's why it's very helpful to have a managed care plan through a provider, through a carrier like MVP. There's no monthly premium. The eligibility is determined by income and household size, and also immigration status. So we have a lot of immigrants in this area, people that are non-citizens. As long as they have the appropriate immigration paperwork, we can enroll them into a plan. Again, the qualifier is for adults 19 to 64, pregnant women and infants, children ages 1 to 18, adults 19 to 20 living with a parent, blind or disabled individuals at any age, undocumented non-citizens age 65 plus, and people not eligible for Medicare also qualify for Medicaid. Key benefits include preventive services, doctor's visits, hospital care and diagnostic services, emergency room care, mental health and substance abuse support services, dental care, vision care with eyeglasses, 24/7 virtual care, low or no co-payments for prescription drugs. Enrollment, again, available year-round. HARP, again, is an extension of Medicaid for people who have certain needs for certain services beyond what Medicaid can offer. It's a Medicaid plan option for members with significant behavioral health needs, offering enhanced support and care coordination. Medicaid members ages 21 and older and individuals with qualifying behavioral health needs are the eligibility requirements, and the key benefits, again, enhanced mental health and substance abuse support, personalized care management and coordination. And that's important because a lot of times people feel like they're on their own in their medical journey, especially people that are struggling with substance abuse or mental health issues, to have someone they can count on to help them manage their health care needs. It goes a long way for them, not only going through treatment, but maintaining their treatment and taking steps to improve their lives and their outcomes.